A facelift is a plastic surgical procedure essentially designed to rejuvenate the face, and it's often done in conjunction with a neck lift procedure called the cervicoplasty. The real name for the facelift surgery is a rhytidectomy, which essentially means the surgical removal of the wrinkles in the face. And these procedures are done as the gold standard for rejuvenating the lower two-thirds of the face, because that's really where all their attention is focused. Now, typically when someone explores or has interest in a face or neck lift procedure, it's often the neck that is their area of interest. As the neck starts to change, it's one of those hallmarks of aging that a lot of people like to try to reverse if they can. So the procedure itself to address the neck really in an isolated fashion can only be done in somebody under the age of 40. And that is only somebody that has sort of congenital changes in the neck, or changes essentially that is very, very familial and not related to sort of aging that we see everywhere on the face. And that's why often we're doing these procedures in conjunction, addressing the face and the neck together to give you that normal harmony through the neck and the jawline. So together, the procedures address not only bringing the cheek fat pad back up onto the cheekbone prominences to make you look more youthful, but it softens the nasolabial folds or the smile line folds against the side of the inside cheek close to the mouth. The jowls are also addressed to resharpen the jawline and really give that a nice rejuvenated look. And of course, the neck is redraped and sculpted to give you that younger neck that you remember when you were in your youth. A facelift is typically performed under general anesthesia, as it takes a number of hours to perform the procedure. And procedures traditionally used to be performed by just tightening up the skin alone, but over time, as plastic surgeons, we found that wasn't a valuable way of establishing a long-term correction. So what I typically perform is a dual plane approach, sometimes also with the extension of additional incisions down the neckline to address necks in patients with significant skin redundancy. But ideally what's done is incisions are placed within the hairline and hidden around the contours of the ears, and a skin and thin fat flap is elevated to allow me access to the inside of the cheeks and in the mid-face region. What I then do is create flaps of the superficial muscular system that contains not only some of the lateral facial elements, but also the fat pads, and allows me to reposition all of those structures back up into their normal youthful anatomic positions, so that the face looks full in the upper portion of the face. Then by anchoring those tissues in those positions, I can then redrape the facial skin on minimal tension, creating ideal scars and a much longer lasting result. Now with procedures like that, I'll also get a minor correction of the lower eyelids, which I often have to make adjustments with at the same time. But again, as we said, this is a procedure designed to correct the lower two-thirds of the face. The last component, of course, of that would be the redraping of the neck and the resculpting of the neck in a couple of directed planes to give us that nice angled look to the neck again. Now, it's important to remember that it's a lengthy procedure, so some people will ask, well, why do they have to go through something like that? Why wouldn't they just opt for something simple, like using a filler or maybe even fat grafting to add additional volume? Well, you have to remember that as the face ages, the face tends to collapse. It goes from having the fat pads and all the healthy, youthful tissues up high in the face around the cheekbones and having our jawline much more sculpted, to having a reverse of that, where we're seeing heaviness in the jowls, a boxiness and squareness of the jawline, and with less volume up in the high cheeks. So if that sort of heaviness and that broad jawline is what we're starting with, by simply adding volume alone, we can only mask some of those changes, but we still end up with a much boxier looking face and not one that's sort of re-anchored with all of the internal structure to readdress that or try to recover that youthful angulated shape to the face. So I often encourage people that have those changes, significant changes, to consider having a facelift procedure done. Typically a facelift procedure often lasts the better part of about 10 or more years, but sometimes people can see positive effects of their facelift, many years, 15, 20 years after their surgeries. Many of the issues of longevity of correction depends on unique patient factors, and patient to patient that varies so broadly. The facial aging has the hugest impact on the longevity of the procedure, and that depends on your genetic makeup, the way your family, your mom and dad has aged, and also the environmental factors. In other words, do you smoke, or have you had a lot of sun exposure that would address or break down skin collagen and skin proteins that prematurely age the face. So for that reason, often it's better to have a facelift procedure done in your 50s, because if you have the procedure done in your early 50s, the longevity of the correction appears to be significantly longer. You're basically tightening up some of those tissues early, so they're having less impact falling and weighting on the skin. So that's probably the most ideal time to have it, but certainly a lot of people get significant corrections way into their later 60s, but again, depending on their final goals and their expectations. Typically, scars from facelifts are often hidden primarily within the hairline. Certainly in the temporal hairline, when we do the superior part of the incisions around the ear are essentially hidden in the contours of the ear, and then the remaining incisions are hidden back in the posterior hairline, with some extension down into the neck and the posterior hair, depending on how much correction we're doing to the neck itself. So often the scars are well tolerated, and they do fade over the course of about 12 months or more. They can be hidden by makeup early on and are really well tolerated for the most part. As far as downtime for the surgery, it usually requires about 3 to 4 weeks of committed time for recovery. Often you're wearing facial garments for early compression to contour a lot of the changes, considering icing to reduce some of the swelling, and again reducing activity for about 2 weeks after surgery to avoid any excess bleeding. Now, a final question we often get again is what's happened or what's new in facelift surgery, and probably the most recent advent to the surgery is considering doing fat grafting in addition to your surgery. So doing procedures that allow for dual plane lifting, which I guess in its own respect is probably more in vogue over the last 10 years to address the internal structure without putting the tension on the facial skin, and then adding in those the volume of fat into the fat pad areas once those pads have been repositioned to sort of really make that face look sort of fresh and youthful. And the combination of those two factors are probably the things that have changed more recently.